Hello, Sarah. Hello, everybody. I'm so sorry that I double scheduled myself to be somewhere else at 6 o'clock tonight. And I was supposed to be with you all at 6 o'clock tonight, but my schedule got a little crazy and I do apologize for not being there in person. But hopefully I can run through a brief lecture, talk about all sorts of things related to sex and cancer. And then if you have questions, maybe you all can get a group email started and then I can answer them and everybody will get the benefits. So welcome and thanks for joining in. So today I'm going to talk about getting your mojo back after breast cancer because it's something that's really, really important and often not talked about. When you're diagnosed with cancer, it's all about saving your life and making the cancer go away and preventing recurrence. But sex is really important to overall well-being, happiness, relationships. You know, it's not something that we can ignore. So I am an OBGYN and I specialize in sexual problems in women like low libido, painful sex, difficulty with orgasm, and things like that. But I'm also a breast cancer survivor. So I've been there. I know firsthand what people go through. And like I said, the good news is there's plenty of treatments that you can do to make things work how you want them to work. And it's all about finding your new normal. So some people hate that term. I personally love that term. So I'm sorry if I upset anybody by saying finding your new normal, but I believe in it. So, all right. So let's see. Let me just flip through some of these slides. The good news is that there are 14.5 million cancer survivors in the world, and that is growing exponentially because of, you know, all the research that is done in cancer and especially breast cancer. Women are surviving longer, and you can't just let sex go in this, you know, your before cancer and after cancer life. There's a couple myths I want to just throw out there. There's one myth that cancer survivors are all old and that old people are not interested in sex, and both of those are just dead wrong. So there are plenty of young cancer survivors that have their whole life ahead of them, and old people are interested in sex. You never have to give it up. So it's not that, oh, well, you know, you're 60 something, 70 something, your sex life is over. That is absolutely not true. So what I'll go through is just a sort of sexual health 101. You know, what are the female sexual dysfunctions that I see, or the sexual health problems? And the problems that I see most often are low libido, or, you know, lack of sexual desire, difficulty with arousal, difficulty with orgasm, or sexual pain. And these can be very distressing. But they're all interrelated, because if you have painful sex, then you're going to have low desire. And if you have low desire, then you're not going to feel aroused, and then maybe you won't be lubricated and you won't be able to reach orgasm. So it's hard to sort of separate them out. And one thing that's really important about libido for women, just in general, you know, breast cancer aside, is that libido for women tends to be more responsive than spontaneous. So men, these are broad generalizations, are much more likely to have random sexual thoughts throughout the day, or to just be thinking about wanting to have sex with a partner. Women in general tend to have sort of the reactive desire. So a hug, a kiss, attention, maybe somebody took the trash out, maybe brought home a little gift, a sexy text. Women tend to have more of a responsive desire. And sexual function has a lot to do with hormones, which really get messed up in cancer. But hormones are not the only thing that plays a role in normal sexual function. There are many neurotransmitters in your brain. You might have heard of some of these: dopamine, serotonin, things like that, that also play a role. So all is not lost if you've had your ovaries removed, or if you're never allowed to use hormones again. There are plenty of other things that play a role. And then beyond hormones, there are, you know, things like interpersonal relationships that can get in the way of normal sexual function, or societal influences, what we were taught growing up, depression, anxiety, things like that also play a role. So when I see my patients, I really focus on taking care of the entire patient, not just, oh, we're going to treat the vaginal dryness. We got to talk about body image. We got to get the depression under control. Yes, we're going to work on the vaginal dryness and the painful sex, but it's I have much more of a holistic approach, because if you just sort of piecemeal the treatments, you won't have as good of an outcome as if you take care of the whole patient. So it's kind of my mantra. And there are a lot of medicines that affect sexual function too. So if you're a breast cancer survivor and you're unable to use certain things, then we really focus on, maybe stopping some of those medicines that can affect sexual function, as long as they're not related to preventing breast cancer recurrence. But there's plenty of medicines that maybe you could be on a different medicine that didn't have that same side effect. So I always look at that too. So I'm going to move on to cancer now, which definitely turns your world upside down. We've all been there. You have sort of your pre-cancer life, then somebody tells you you have cancer and your world is rocked. And everything after that becomes, let's get this treated. You focus on it, get this treated, see this doctor, see that doctor, the surgeon, the oncologist, the, radiation expert. It's such a tough road to go down. But eventually you get better, and then you have your life ahead of you. And some women will feel, why should I worry about sex? I should just be grateful to be alive. But I don't buy that. You can be having sex is just part of a normal life. It's, we wouldn't be here if sexual function wasn't important. So I have in my presentation, there's a book, The Love It Ain't Over for Women with Cancer. There's a lot of good support systems out there, good books about sex after cancer, because yes, it's good and it can be done. And you really want to focus on rehabilitation and finding your new normal. So what you did before cancer is likely to be different. You may not be able to do things how you used to do things. You have your new normal, my favorite term. So a couple just basic behavioral things is you really want to be pleasure focused, not goal focused. So enjoy every minute of touching and intimacy and love, as opposed to, I gotta reach orgasm. There's so much more that you can get out of sex by being pleasure focused instead of goal focused. And remember that you're not alone. Cancer can feel like it's only you and why me? This isn't fair. Everybody else is fine. But there are millions of women experiencing what you're going through. And so if you're having difficulties with sex, see a physician, see somebody who specializes in this, or a sex therapist, a medical professional, because there's, a variety of cancer-related issues. There are changes, anatomical changes from surgery. So if you had a mastectomy where they remove a breast, or if you had a lumpectomy, you might be very concerned about what you look like. You might have burns from radiation. And then you might be on these hormonal modulators or adjuvant treatment like tamoxifen, aromatase inhibitors, things like that. So all of this stuff you already know, but what I really want to talk about are some of the treatments that I offer my patients with breast cancer. So we'll get to those. And vaginal dryness and painful intercourse is what I'm going to focus on first, because that's definitely the most common. The second most common issue I see is low libido for a variety of reasons, either due to painful intercourse or lack of hormones. So we'll talk about things that you can do. Okay, so what can we do? So I do a little bit of discussion of working on sexual self-esteem, learning to feel good about your body. If you're not exercising, go to the gym, do everything you can to make yourself feel good about your body. If you're depressed or anxious, yoga is definitely the way to go. You don't have to spend money on it. You can download yoga from the internet. I personally do yoga by Candace. I think she's awesome. Her voice is very soothing. There's all sorts of things you can do to feel good about your body. You can also cover up your chest. If you're embarrassed by it, you don't like the way it looks, buy a sexy bra, buy something sexy and just leave it on. There's no rule book that says you have to take your bra off. Okay, so what about dryness? So let's focus on vaginal dryness first. So there are a variety of ways that you can treat vaginal dryness. So what happens to the vagina when there are no hormones left is the tissue becomes thin and dry. So when there are hormones, if you were premenopausal, before cancer, the tissue in the vagina is thick, moist, and it's stretchy. So it's elastic. That's one of the things that estrogen does for the vagina. When there are no hormones, it becomes more like a sheet of 8 by 10 piece of paper. So if you poke it, it might tear. It doesn't stretch with intercourse. And it also doesn't lubricate as well. So your body's not going to make as much lubrication as it used to. So what can you do about that? So I'll talk about lubricants, then I'll talk about moisturizers. So lubricants are for use during sex, and basically they're to help things slide, to decrease the friction, which helps with the pain. The lubricant that you want to use is a silicone-based lubricant or something like olive oil or coconut oil. Some people prefer the natural route, that's the olive oil or the coconut oil, or you can purchase a silicone-based lubricant online. And actually, I have a website called womenssensualhealth.com. And if you go to that, and I'll send Sarah all these links, I'll send all this information out. 10% of the proceeds when you buy things, you can buy lubricants and moisturizers on this website, 10% of the proceeds will go to Gateway to Hope. And Gateway to Hope is a charity that pays health insurance premiums for women with breast cancer who are uninsured or underinsured. And can you imagine not having health insurance and finding out that you have breast cancer? You already have enough on your plate than to worry about finances. So anyway, womenssensualhealth.com. So if you want to use a lubricant, get a silicone-based lubricant or olive oil. You put some in your hand, you put some on the outside of you, which is called the vulva, and then you put some on your partner's penis as well, and it just really helps with friction. And lubrication, the lubricant, is for use at the time of intercourse. You don't have to do that on a regular basis, just when things are happening, you use the lubricant. And you'll likely have to use a lubricant forever, and that's okay. That's totally fine. That was gonna happen anyway when you hit menopause. You don't want to use the water-based lubes because unless you're using condoms, the water-based lubricants dry up quickly, they have to be reapplied often, and they're actually very drying to the vaginal tissues themselves. They pull the water out of the vagina. So throw away your water-based lubes. We all think, oh, water, it sounds better than silicone, which sounds like a chemical, but actually you really want to go with silicone or olive oil or coconut oil. Okay, what about moisturizers? So you can also use vaginal moisturizers, and these are designed to be used on a regular basis. So things like Replens is the one that you hear about. I personally don't like Replens. It can be a little bit drying too. I think the one that works the best is actually Crisco. I know, go figure. Or coconut oil, that's solid. So when I say Crisco, I mean the solid form. Or coconut oil, the solid form. I've seen it at Trader Joe's. And what you want to do, you can use it as much or as little as you want. It's just like when you go to the bathroom, you wash your hands and then you put some hand lotion on your hands. You want to do the same thing with the vagina. So some people will put some Crisco on their finger and just put it on the outside. Other people will put some on their finger, put it inside the vagina. You can do it twice a day. You can do it once a day. Some people will put Crisco in a little tub, and every time they go to the bathroom, they pat dry and then apply the Crisco or coconut oil, and it's just like putting hand lotion on your hands, and you do that on a regular basis. Okay. All right, so I'm going really out of order from my slides. Or maybe I should stick with going with the slides. Okay, I'm gonna stick with the order of the slides. So the other thing that sometimes happens is if you haven't had sex in a while and you don't have hormones around, the vagina can get very small. It can actually shrink, and the vagina is kind of a use it or lose it. So it's actually good to have sex to maintain vaginal health. It brings blood flow to the vagina. Blood flow helps with nerve growth. But sometimes people will go for a very long time without having sex, and then they don't have hormones. So I also will sometimes use vaginal dilator. Hello, sorry about the interruption. I was talking about vaginal dilators, which look kind of like candles. And sometimes when the vagina gets small or it's too tight, it's shrunk due to lack of hormones, lack of use, you can use vaginal dilators to make it comfortable again to have sex. And they're sort of graduated cylinders in a way. So you start with a very tiny one, you get a little bigger, 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 and you can use those to expand the vagina. So anyway, the dilators you can buy in our office, you can find them on the internet, or you can find them on Women's Sensual Health. The other thing you can do sometimes is a little bit of topical lidocaine right at the introitus. So the vagina, if you're looking at it, it's shaped about like this, and this is the spot, kind of like if this is your bottom, this is the area that tends to hurt the most. And so some women will put just a little bit of lidocaine, which is a numbing medicine, just to kind of take the edge off. All right. Moving on to other things. So typically what we say is that if you have tried all the other moisturizers, lubricants, everything else, and it's not working for you, then you have to weigh the risks and benefits and decide if you want to use a vaginal local hormone treatment. What the American College of OBGYN says, what the North American Menopause Society say, is you can choose to use a tiny bit of very local, you can never take hormones, swallow pills and all that, but in the vagina, a low dose of a vaginal hormone, if you've weighed the risks and benefits and decided that's what you want to do, because vaginal hormones have never been shown to increase the risk of recurrence. Now, if you swallow a pill, that has definitely been shown to increase the risk of recurrence. But the vaginal hormones have not been shown, but theoretically, a little tiny bit is absorbed into the bloodstream of most of the estrogen products. There is a product that is Intravaginal DHEA. And it's a little suppository, and it goes in the vagina, and it gets converted in the vagina to estrogen and androgens. And the vagina needs both of them for elasticity, for lubrication, for moisture. And the benefit of that one is that it doesn't raise the blood levels of hormones any higher than the normal postmenopausal range. So if I'm taking care of a patient who has decided to try vaginal hormones, and that's my go-to, that's the one that I choose the very first, because it doesn't raise the blood levels any higher than they would be for a normal postmenopausal woman. Intravaginal DHEA has been studied in breast cancer patients on aromatase inhibitors. So aromatase inhibitors are like anastrozole, letrozole, there's a couple others. And aromatase inhibitors, or AIs, work by lowering the estrogen level even below the normal postmenopausal range. And they did a study with intravaginal DHEA in women on aromatase inhibitors, and the estrogen levels remained ultra, ultra low. So for breast cancer survivors on aromatase inhibitors, if they decide to do vaginal local hormone, then that's the one I choose, because it really doesn't raise the blood levels any higher than they should be for where you're at. You could also choose to use a very low dose estrogen. There's a tablet. It's not my favorite because I don't think it works very well. The creams work well. The creams give you a little bit higher level in your blood though. If somebody is on tamoxifen, then I might choose a cream if they don't like the intravaginal DHEA, because tamoxifen blocks the estrogen receptor. So if there were a lone breast cancer cell floating out somewhere, in your body, the tamoxifen will bind to the receptor and prevent any estrogen from making that breast cancer cell grow. So anyway, there are options, and I think they're good options that we have available right now. Another thing that I want to talk about that is treatment for vaginal dryness is vaginal laser. And actually, I think we are going to be getting one of these at St. Mary's, so I'm really excited. The vaginal laser, the way that it works, it's a procedure. So that it's non-hormonal, there's no hormones involved, and it doesn't hurt. It's done in the office, and it almost looks like an ultrasound probe, and it goes in the vagina, and it uses laser light to break down the vaginal tissue and the old collagen that's not very elastic, and then your body builds new collagen. It's a relatively new procedure. It's been around since 2012. So as far as the science goes, the data goes, we don't have long-term studies on it, but we do have several short-term studies, and the results look very, very promising. And then you don't have to deal with putting something in the vagina each night. So that is something that I think might be up and coming. But that is the vaginal laser. And there are studies in women who have breast cancer that show that it does improve elasticity and lubrication and moisture and painful sex. So that is the laser. The other thing that I want to touch on is when sex is painful, then your natural inclination is to tense up, and you can end up with something that's called pelvic floor muscle spasm. So when you think it's going to hurt, you tense, and then that makes it hurt more, so you tense even more. And then your body just naturally tenses, and even if you had the laser, you used intravaginal DHEA or something like that, that tension can still cause painful sex. The way that we treat that is with pelvic floor physical therapy, and they do a fantastic job at teaching you to relax those muscles. So I always check for that when I see my patients, because if we fix the other problems but we don't fix the pelvic floor muscle spasm, then you won't get completely better. So that's another thing that I sometimes recommend. Sometimes we can also use a vaginal Valium, where you just take a Valium, which is a relaxing agent, and you put that in the vagina, and it helps relax the pelvic floor muscles. The problem with that is it does get absorbed into the bloodstream a little bit, and we don't want you to get addicted to it. So I tend to use it as a bridge to sort of get you through to physical therapy, so you can learn to relax the pelvic floor muscles on their own. Okay, I want to talk a little bit about libido. So testosterone controls libido, but so do other neurotransmitters. And when you've had breast cancer, we tend not to give you testosterone. But there is a medicine called Addy that is not a hormone, and that can help low libido. It came out 2015 or so. They had coupon cards, so it wasn't too expensive. Then the drug company sold it to a different drug company, and it's been kind of ultra expensive for a while. But I just found out that if your insurance covers it, you can get it for $25 at a mail order pharmacy. And if your insurance doesn't cover it, it would be $100 a month or $99 a month or something like that. I have several patients on Addy, and they seem to like it. It's not going to give you the libido of a 15-year-old boy, but it makes you a little bit more receptive, a little bit more interested, and sometimes that's all you need to kind of restore the relationship. So that's wonderful news. I'm so excited about that. There is also another medicine that will be coming out, probably within the year or so, called bremelanotide, which works through melanocortins. Addy works through dopamine. And so that bremelanotide is non-hormonal also. That will be used on an as-needed basis to help improve your libido. So it's been through phase 3 trials. It's just waiting for that final approval, and I'm really looking forward to that one also. The other thing you can use is a medicine called Wellbutrin. You might have heard of it. It is bupropion, which has been used for depression, but also to help people quit smoking. It has been shown in small studies, not big ones, not many, to help improve libido through dopamine. So if all else fails, if we can't get anything else, then sometimes I'll use Wellbutrin. All right. One more piece of information. There is something called an O-nut, and it just recently came out also. They used to have ones called the Come Close ring, and there's pictures of it in my presentation. But basically, it's a cushiony ring that goes on the shaft of the penis down at the bottom, and it sort of works as a vaginal extender. So some women have painful intercourse because the vagina is very short. Especially women who've had radiation to the vagina if they had vaginal cancer or cervical cancer or something. But it's a vaginal extender. So the man puts it on and it makes him feel like he's able to penetrate deeper. But for the woman, it really helps because he doesn't have to penetrate deeper. And that's called the O-nut. OHNUT. So that information is in the presentation too. So just to wrap it up, having breast cancer can really affect your sex life. It affects your sexual self-esteem. Some people feel like nothing is woman, no breasts. People get a hysterectomy, ovaries are removed, no hormones. But there are plenty of treatments that you can do, and it's totally okay to do this to restore your sex life and restore sexual pleasure and overall happiness and well-being. So I appreciate you all listening. Sorry for the double booking. I have several social media sites if you're interested in following interesting articles and things on sexual health. I post on Twitter. It's all in my PowerPoint. I post on Instagram and on Facebook. I have this YouTube channel, and you're welcome to listen to any of my other short videos about sex. And if you want to send me questions, I will be happy to answer them either late tonight or tomorrow. But thanks for bearing with me and tuning in. See you later. Bye-bye.